Thank you very much. It's a great pleasure to be here today. I have been learning a lot of. It's been a great pleasure for me to be here this morning. I have been learning, and I'm going to continue learning a lot of very interesting things about your work. Because I have to say thank you to all of you, because the work that you are doing in order to provide us these tools and this environment in terms of security and regulations to offer our patients this digital solution in our daily clinical practice is great, no? And I would like to share with you the point of view of a surgeon who are trying to use and introducing this new digital solution in our daily clinical practice, and in which part of the complete management pathway of our patient I feel that are going to be more helpful in the present and in the next future. So the evolution of the surgery is mainly because of the evolution of technology, and there are some moments in the history that are really important, that have been a real revolution. Think about the beginning of the anesthesia, the beginning of the antisepsia, more recently the minimal invasive surgery instead of more aggressive procedures. But now we are living probably the next big revolution, is the digital surgery. And when we think about digital surgery, we have to think not just in the operating room, that is amazing, all the tools that we have available in the operating room, but we have to think about all the patient pathways. We can find these tools in the preoperative management. We have been listening a lot of information about that during this morning, of course intraoperative, but also in the postoperative management of our patient. So in preoperative surgery, the artificial intelligence are going to help us a lot in order to improve the imaging, improve the diagnosis of our patients, but also trying to have more personalized patient risk factors information. Nowadays, we every day have involving more and more the patient in the decision process in making about treatment. Think about, for example, in my field now in the rectal cancer treatment, there are a lot of patients who have achieved a complete response with medical treatment and could benefit for avoiding the surgery. And we are sharing this decision with the patient. So we have to inform the patient carefully about the pros and cons to this more conservative management. But we need to give the patient the best information in order to patient have the best quality decision and the best quality concern about the strategy of the treatment. And that's why we need to collect all this data in order to have a personal endeavor. That's the way we are working in the last 10 years. We are a team that has been very worried about the importance of know about our own data from the last 10 years. We have a database of more than 9,000 patients registered, and in the past we have been using this in order to audit continuously our outcomes, in order to find which clinical changes we can implement it to improve the outcomes. But nowadays we are also thinking about using to give personalized information to our patient, because this is a little bit of domestic management of the data. But I think it's very helpful because the patient can know exactly some risk aspect of the treatment in our hands, in our involvement, based on patient characteristics and based on our own outcomes. I think it's a field that we are going to improve in the next months. And we are also working in prehabilitation. Prehabilitation is very important. If you optimize patient conditions to the surgery, you are going to decrease the risk of complications. You are going to improve outcomes. Prehabilitation is a field where digital solution can play a very important role. There is a lot of experience. There is a lot of publication about how digital solution can help patients to manage all this information that they have in a rehabilitation program. But this way to work is also important to decrease the stress of the patient. Do you imagine if you have to wait for 4 to 6 weeks for a surgical treatment, if you have an oncological procedure, and you are just waiting for your surgery, it's very difficult to manage, no? But if you are in contact with the team and you are into a rehabilitation program, you have information about how is the best nutritional aspect that you have to keep during these weeks, respiratory rehabilitation, whatever the patient needs, tailoring the need for the patient. And these tools can be very useful to have this connection with the patient during all these weeks. And another amazing in the preoperative is development for the digital solution is the simulation. So now we have changed a lot of the way that we train young surgeons, residents, because we have a lot of possibilities with simulation. And also very important, and I want to share you our experience in that sense, we can improve a lot the surgical patient. We are in times that we are thinking about personalized medicine in all the aspects, not just because we are looking for best treatments in order to, for example, the biologic characteristic of the tumor, but also we have to think about the variability in the anatomy of the patients. So I'm a colorectal surgeon, and I'm going to give you just examples of colorectal surgery, but you can imagine this in all kinds of surgery. Patients are different, so we are using these 3 models in our patients to know exactly the relationship of the tumor with other structures, but also very important to know exactly the anatomical variation on each patient. In the colorectal anatomy, the vascular variation is very, very high. And sometimes this information can even change the procedure that we are going to choose. And it's a great tool that we have for planning, available nowadays with a high level of precision. This is, for example, a case of a tumor, and you can see here, because that is important, the variation of the branches of the artery that we are going to divide for the surgery, and sometimes this information could even change. For example, in that case, that we have the information that is an anatomical variation in the vascularity of the patient, and then during the surgery, we are checking that the information is very valuable. We are going to find exactly the branches where the model have predict us in the planning. So it's very helpful. And this is with another software. This is a very, very, very complicated case because it was a 32 years lady with an unresecable tumor of the colon at the beginning. We start with a neoadjuvant treatment, and then we perform this 3D model in order to know exactly if the tumor, after the response of the treatment, involves some structures that could be difficult for achieve a complete resection during the surgery. And we can remove these organs, looking for exactly the information that we need from the invasion of rectoperitoneal structures. This is just an example. But this, for example, is you have the probability of the other structures have been involved by the tumor. This tool gives us this information. So at the end, fortunately, it was just the invasion of the abdominal wall muscles, so we can operate this young lady without problem. And also, when we start with new technique, for example, when we start to operate the rectal tumor cases from transanal approach rather than from abdominal approach, and we have to change completely the way that we are looking the anatomy of the patient. So we can use also these tools because we can move, we can make rotation, zoom, and we can place the anatomy in the exact point of view that we are going to have later during the surgery. This is very, very helpful, mainly at the beginning of the learning curve when you introduce a new surgical technique. And one of the advantages of these tools is that it can be managed by ourselves as a surgeon without the need of the radiologist, because we know exactly the information that we need for each particular case, so it's easier for us. And this is for planning, but also it's very important during the surgery. There is a lot of new things and things to come in the future that are going to change completely the way that we are operating That is just an example. We need to integrate all this information, all these models during the surgery to improve the navigation. It's a great tool nowadays for planning. They have to improve for navigation because we need to integrate these images with the real images. We can use the augmented reality mixed with virtual reality in order to have the best information during our surgery to improve our outcomes. But also all the possibilities that we have as a surgical eyes of the new technology. Now, the technology can help us to decision. We have to decide in just that minute about if we can do the biodish artery or no, or different aspects of the technique. And within artificial intelligence, we have the information, we have more, we can make a decision supported by data better than just with the experience, no? And also the devices. The devices are going to have are going to give us a lot of information in terms of security. If this tissue can be translated with this device, or you need another one, how many times you have to keep the compression, because the device are going to choose the best way to fight in according to the tissue condition, rather than make it the same way, whatever was the condition of the tissue. All these things are coming. Some of them we have available now, and they are going to change completely the training process. We're going to train better new surgeons using all these tools, of course, in a robotic environment, and also for telesurgery, for remote monitoring, we have can make new surgeries with the help of an expert that don't need to be on the theater. It can be in other times, guiding us in the first surgery. So this is a wide field that we are developing nowadays. But also in the postoperative period, we have used early warning systems to make earlier diagnosis of complication. And this is very important, because when you treat a complication, as soon as you make the diagnosis, as soon as you treat the complications, probably the consequences are going to be less for the patient. So it's very important to use all these things. Last week I heard about one microchip in the anastomosis that can give you information about some changes, some inflammatory changes, just when they start to happen, and then you can go and act to the anastomosis before the leak or the sense of the anastomosis was complete. This is important. Maybe you can save a lot of patients for a definitive stoma, for example, because if you make an early diagnosis, then you can reduce the anastomosis, avoiding an stoma. It's important for the patient mainly, but it's also important for the system, because a permanent stoma is very expensive. So when we think about the price of the technology, the price of the innovation, we have to think about the outcomes and how the complications are going to impact not just the patient, but also the sustainability of the system from economical point of view. So I think the digital surgery have a lot of benefits from patient's point of view. Of course, are going to improve the outcomes, and are going to, for some, the early diagnosis of complication is important, are going to allow us to personalize treatment, personalize support our decision in terms of achieve one or other procedures. And also for surgeons, we are going to improve our operative planning. It's very important for training. It's very important the help that these tools are going to give us to support our decisions, and are going to help also us to standardize the procedures. And standardizing procedures is also a way to decrease complications, but also for the institutions are going to be a great new scenario in order to make surgery and treatment more cost efficiency, and also is a way also to control, to have a better control of the outcomes, and try to implement changes when we detect the problems. And this morning we have learned a lot about the challenges. You know, all of you better than me about the challenges. I have learned today that there's challenges that as a clinician we are not worried about, but are crucial in order to have available these tools. And for us, for example, is a problem about the data. Who collect the data? We talk about how many times the physician lose with the relation with the patient because we are on the screen. We have been working in that during 10 years, and we don't have any support of our institution. We collect the data by our own because we are worried about, we know the importance, but we need support to this in order to pay more attention to our surgeries, our patients, and have the help of the institution to collect this data. And also nowadays, at least in my environment, the hospitals and the healthcare system are not prepared enough for all these changes that are coming. And the other things have been discussing this morning perfectly. So thank you very much for your attention.